Hello, my name is Lindsay Gerke, and I'm doing my physical examination for advanced healthcare assessment. Prior to coming into the room, I asked the patient to empty his bladder. We also took his weight, height, and his blood pressure, as well as tested his vision with the Snellen chart for cranial nerve number 2. His weight was 218, his height is 6'1", and his blood pressure of his left arm was 118/64. His vision is 20/20. He does not need corrective lenses. So I'll be performing a health exam on you, and I will be talking to the camera as well. So the first thing that I'm going to do is to assess his skin and his hair and scalp. So looking at my patient, he does not have any lesions, any discolorations, no nevus, and his hair is thick with no balding patches or thinning. I'm going to palpate his scalp now. Any tenderness?
No.
Scalp is free of any masses or lesions and free of tenderness. I'm going to feel the temperature of his skin with the dorsal aspect of my hand. Patient is warm with a good skin turgor. Now I'm going to palpate his facial bones for any tenderness. Any tenderness?
No.
Okay. And I'm also looking at his hair distribution across his face, which is equal on both sides. Now I'm going to move on to his eye examination. And first looking at his eyebrows. His eyebrows are equal, and they reach to the outer canvas. Can you close your eyes? Looking at his eyes, he is free of any masses or lesions, no swelling or bulging. Go ahead and open. Eyelashes are going correctly outwards, no entropin or ectropin. I'm going to palpate his lacrimal glands. Good. And palpate his sclera, free of nodules. His lacrimal gland is free of any discharge or redness. His sclera is white, and his conjunctiva is pink. So I'm going to check for his pupillary response. Good. Both pupils constrict respectively. And now I'm going to check for accommodation. So I'm going to have you look at the computer for a few minutes here. And now I want you to focus, when I bring my pen light up, focus on my pen light. And then I'll have you do the other eye. So I'll have you look at the computer again. And then when I bring my pen light up, focus on my pen light. Accommodation is appropriate. Now I'm going to do the cover and uncover test. So can I have you cover one of your eyes, please? Okay. And now uncover. Good. Now do the other eye, please. And uncover. Great. And now I'm going to do the 6 cardinal gazes. And just follow my pen light. Perfect. So there's no nystagmus noted. And now I'm going to test for his red reflex. This is going to be a bright light, and I'm just going to have you look at me when I am shining the light. And I will use the same eye that I am testing as I'm looking through the ophthalmoscope. Good. Good. Red reflex is present. I'm also going to be testing some cranial nerves right now. And I would like you to puff out your cheeks, clench your teeth, wrinkle your forehead, close your eyes. Good. And now I'm going to be testing sensation. So can you tell me if this is sharp or dull?
Dull.
now I'm going to ask you to close your eyes and tell me where I'm touching you at.
Okay. Cheek. Nose. Cheek. Chin.
Perfect. So this tells me that cranial nerve 5, 7, and 12 are intact. And how about, do you have any tenderness of your sinuses?
No.
Okay. Free of any sinus tenderness. So next I'm going to be moving to his nose. And here I am looking to make sure that he has equal symmetry, sorry. And from the outside, his septum is midline. Now, can I have you close one nose hole and breathe in and out? Okay, and do the other side. Okay, so terminates are patent. And now I'm going to do an internal exam of his nostrils. So nostrils are patent. There is no lesions or masses found. And septum remained midline in an internal examination. So next I'm going to be moving to his ear examination. So I'll first look on the outer auricles of his ears. I am looking for any masses or lesions and feeling for tenderness. Does it hurt when I pull?
No.
So tug test is negative. So I'm going to do an internal exam of his ears. There is some cerumen present. The tympanic membrane is visible, gray and pearly with landmarks visible. I'm going to check his other side. Same, cerumen is present, but the tympanic membrane is visible, pearly and gray with landmarks as well. So I'm going to be testing his hearing now. And I will be doing the bone and air conduction. So I'm going to hit my tuning fork and I'm going to put it on the back of your ear. I want you to tell me when you can't hear it. And then I'm going to move it to the front of your ear and tell me when you can't hear it, okay?
Okay. Can't hear it.
Can you still hear it?
Yep. Can't hear it.
Okay. So now I'll do the same to his other ear.
Can't hear it. Can't hear it.
Okay. So that air conduction was twice as long as bone conduction. And now I'm going to see if you can hear, that was the Rhine test. So now I'll be performing the Weber test to see if we can hear equally in both ears. So I'm going to strike this and put this on top of your head and let me know if you can hear it better in one ear or if it's equal.
That seems to be equal.
Okay, so next I'll be moving on to his mouth. And I'll be looking first at his lips, and they are free of any lesions or crusting. Can I have you smile for me, please? Okay. His smile is symmetrical. And I'm going to take a look on the inside of his mouth. Okay. Say ah.
Ah.
Hold it. Ah.
Ah.
Okay. His mucosa is pink and moist. Pull your lip down and check your gum here. His gums are pink and moist. Alright, his ah reflex is intact. I'm also going to check his gag reflex. Gag reflex is present. Tonsils are at a station 0. And pillars are moist and pink as well, with no signs of swelling or discharge. So cranial nerve 9, 10, and 12 were tested. I'm also going to have him smell. What do you smell?
Peppermint.
I'm also going to have him read for his near vision test. Are you able to read that first sentence?
Each room may hold a special invitation springs private sale.
Okay. Do you have any problems hearing?
No.
Okay, so I'm going to perform the whisper test. And can you just repeat what I say?
Mickey Mouse.
And then I will do the other side.
Donald Duck.
Perfect. Okay. So now I'm going to move on to his throat and his neck. So I'm going to palpate. Any tenderness?
No.
Okay. Now I'm going to feel his esophagus. There's trachea. His midline. And then I'm going to have you swallow. There's no nodules present on the thyroid. And then I'm going to have you do a range of motion exercises with your neck. Can you move your head from side to side? And backwards. Okay, forward, touch your chin to your chest. Perfect. Now I'm going to have you push against some resistance. So push against my hand. Good. This way. And back. Good. His strength is normal. Proper range of motion. So now I'm going to also assess his lymph nodes of his neck. So we have the preauricle and postauricle, superficial cervical, posterior cervical, and deep. His occipital, submandibular, and submental. And I'm just going to travel down and feel his subclavicular. No lymphadenopathy felt, no hardening or swelling. So I'm also going to palpate his arteries, carotid arteries, separately. +2, no bounding. Okay. I'm also going to auscultate. Okay, take a breath. No bruise noticed, and bronchovesicular sounds over his trachea. And now can I also have you do a shoulder shrug for me? Good. Just nice and up tight. Any pain or discomfort?
No.
Okay. That is cranial nerve 11 being tested. So now I'm going to move on to his chest, and I'm going to start from the posterior chest. I am looking for any lesions. Also take this time to look for any suspicious nevus. Okay. I'm going to test for tactile fremitus. Can you say 99?
99.
And any tenderness on palpation.
Nope.
Okay. I'm going to percuss the costovertebral margins or angle. Any tenderness? Okay, perfect. At this time, I also want to do to measure his diaphragmatic excursion. So for this, I'm going to percuss down till I hear dullness with his breath out as quickly as I can and mark. And then I'll have him take a deep breath and hold it, and I'll percuss till I hear dullness, and then I'll measure. I will do this on both sides. Okay. So I'm going to have you take a big breath and let it out and hold it. Okay. And then now I'm going to just breathe normal for a few. And then I'm going to have you take a deep breath and push it out, or a deep breath and hold it, I'm sorry. Okay. Now I'll measure it. This side is 4 centimeters, which is normal. Go ahead and breathe normal. I'll go do the other side. Okay, so for this one again, I'll have you take a deep breath and let it out. And breathe normal. And this one, I'll have you take a deep breath and hold it. Okay. And then I'll measure. And this one is 4 centimeters as well, which is appropriate. So now I'll move on to his anterior chest. And here I also look for symmetry on equal hair distribution as well. And no lesions. I'll just palpate. No tenderness. And then I'm going to have you lift your armpits. I'm going to feel your auxiliary lymph nodes. Any tenderness? Good. Go ahead and put your arms down. Now I'm going to do tactile fremitus as well. And can you say 99, please?
99.
It's appropriate. I'll percuss over the lungs. It's appropriate. I'm going to listen to his lung sounds, anterior, posteriorly, and laterally, and compare. So I'll just have you breathe normal for me. And now to lift your arm a little bit. Okay. I'll reach around to the other side. Good. Okay. He has vesicular breath sounds, clear. So now I'm going to check the expansion of his chest wall to make sure that it is symmetrical on both sides. So I'm going to put my hand on the base of his lungs and ask him to take a deep breath to see if they expand equally. Okay, go ahead and take a deep breath. Good. Equal expansion. And now I'm going to auscultate for his heart and his aortic. Pulmonic. Erb's point. Tricuspid. And mitral. S1 and S2 auscultated with no additional heart sounds. I am going to listen now with the bell of my stethoscope to see if I hear any additional heart sounds such as a murmur or friction run, and all the same spots. There's no additional heart sounds noted, murmurs, gallops, friction runs. So the next thing that I'm going to move down to is going to be his abdomen. I also want to note that he has had no difficulty breathing. Do you suffer from asthma?
No.
Okay. Or have COPD?
No.
Okay. Breath sounds are normal, and the effort is normal. There's no retractions or use of accessory muscles. So now I'm going to move on to his abdomen. I also like to palpate when they're sitting up, just searching for any tenderness as well. Any tenderness?
No.
Okay. So then I'm going to ask him to lay down and we'll further this examination. So when I visualize the abdomen, I look for any unequal hair distribution, which is normal, any lesions, any visible masses before palpating. I also like to look when they're laying down, the use of their abdominal muscles, which are very strong. I also look to see if there's any shifting of fluid that I could catch with moving down, which he is negative for. And then I will palpate all quadrants for any tenderness. Did you have any tenderness?
No.
Okay. And so now I'm going to actually percuss to find his liver borders. So when it turns to dull, I know I have reached his liver. And then I'm going to percuss over just to see how far. Okay. And then I'm going to do a deep palpation to feel his liver. Any tenderness?
Oh.
Okay. Liver is soft. And now I'm going to move over and see if I can do a deep palpation for his spleen. Spleen is not felt. I'm going to palpate a deep palpation for his kidney. Any tenderness?
No.
Okay, go back and do it on the other side as well. Any tenderness here?
No.
Okay. So now I'm going to also take for his bowel sounds. His bowel sounds are appropriate, and I'm also going to listen now over his arteries, his aortic, his renal, iliac, and femoral for any signs of bruits. No abnormalities also stated. I also look to see for any abnormal pulsations, and there's no abnormal pulsations. Okay, great. I'll have you sit up. Perfect. Any discomfort from sitting up?
No.
Okay. So now I'm going to move on to looking at his legs and his feet. And here we look for normal hair distribution, any lesions or masses, and also any noted tenderness as we move down. Any tenderness?
No.
Okay, I'm going to take your socks off. I'm going to shift this camera down so you'll be able to see this assessment of legs and feet. Okay. So hair is evenly distributed. There is no lesions, masses. There's actually no scarring or scabs as well on either. So now I'm also going to be testing his reflexes. So we'll do popliteal. Okay. Good. And then we'll do Achilles. Do the other side. Okay. I'm also going to be feeling for his pulses, popliteal. Okay. 2+. His dorsal tibial. Dorsal pedis. Okay. I'm going to move the camera back up. I'm also going to check his brachial reflexes, so I'll just have you relax your arm. Okay. I'm also going to palpate his radial pulses. Those are 2+ as well. So I'm also assessing his circulation as we go and looking at his hands and feet. They are pink. Pink. Nail beds are pink with a less than 3-second capillary refill. His nails are clean with no signs of clubbing, any kyanosis, any stickening. Same on this. Appropriate capillary refill. I'm going to check down on his feet as well for appropriately capillary refill. Feet are pink and warm. Fingernails are clean, white with no thickening. And at this time, I also like to assess more range of motion. So I'm going to ask you to bring one knee up and put it back down. Okay. Other knee up. Okay. I'm going to have you take one of your feet and run the heel down your shin. If you can do that for me. Okay. And do it on the other side. Perfect. And as he's sitting here, I'm noticing his spine, proper curvature, and then can you lean forward? No signs of kyphosis or scoliosis. And I'm going to have you stand. Okay, and go ahead and just bend and touch your toes. Good. Go ahead and stay down like that. I'll just feel your spine. And still proper curvature. And he can touch his toes. Okay, go ahead and sit back down. Can I have you do the finger touches? I'm going to have you touch each finger to your thumb. Keep going. Okay. Any difficulty with that?
Nope.
And this will conclude the physical examination.